Jump off that exhausting hamster wheel and into balanced living with Dr. Marissa.
Promise you joy in the mystery.
Dr. Marissa, also known as the Asian Oprah. Her mission, to be a beneficial presence on the planet. Her purpose, to be your personal advocate to live, laugh, love, learn. Her life motto, don't die wondering. Take back your life with Dr. Marissa Pay.
And welcome! You are tuned into my weekly talk radio TV show called Take My Advice. I'm not using it. Get balanced and get happy with Dr. Marissa every Tuesday at naturally high noon, broadcasting out of Burbank, California with UBN Go Studios, and then syndicated on my CNBC NBC radio TV channel, KCAA, AM 1050, FM 102.3, FM 106.5, and everywhere on iHeartRadio, Stitcher, TuneIn, Spotify, you name it. I'm there because this is a show about hope and happiness. So there's no gossip, no scandal, and no K words, no Kardashian talk at all, because I want you to focus on your own reality show and how you can be happy 88% of the time. So if you missed my past shows with Fran Drescher, with Neil Donald Walsh, with Marianne Williamson, with Marianne from Gilligan's Island, Corey Feldman, you name it, all the people who take their limelight and shine it on areas of darkness so that we can find happiness 88% of the time. Some of you may be asking, why not 100%, Dr. Marissa? Well, if you're 100% happy, you're dead. So we don't want that. 88% is our birthright. 8 is a lucky number in Chinese. I know you thought I was Swedish, but I'm actually Chinese. And double 8 is 88% double good fortune, which is your absolute birthright to be happy. So I am super excited to be broadcasting. This is in my 8th year. I actually won the 2016 Podcast of the Year Top 10 in Health Award. And it's my 429th consecutive week on the air on camera. And I think I'm going to get a little bit of love for that. I am also super excited. If you missed last week's show, Not Black or White, it was a fabulous live show. I would encourage you to go to YouTube to look that up. And this week is an equally fabulous show because I'm putting the moose on the table. So those of you who didn't know, I was born in Canada. Putting the moose on the table is called my Canadian version of talking about the elephant in the room. And the elephant that's been walking all over my social media feed is, I'm hearing some music in the background here, but it's about masks. So the question is, to mask or not to mask? That is the question. And if you missed my Medium article on it, it's a sad question. So I wanted to go straight to the source and find someone who's not just, OSHA or posting something that's not from OSHA, or someone who's just talking about their opinion, but I want to know the facts. I want to know the science. I want to know everything. So Dr. Josette Thompson, who's a friend of mine from Seal Beach, where we raised our kids together, has referred me to Dr. Alya Khan. And Dr. Alya is here. She's an occupational medicine physician. She is she's board certified in both internal medicine and occupational medicine. Dr. Khan completed her residency training in internal medicine and a fellowship in occupational and environmental medicine, as well as a master's degree in environmental toxicology. So I brought in the heavy guns and for various reasons, she's off camera, but she's here. You'll be able to hear her. And I'm going to put the moose on the table with some questions. And I do also want to tell you, she is a professor. You may have seen the other, but her views that she's expressing here today are hers from her experience and her research and what she's been doing. So we just want to keep her safe and all of that as well, just because of the nutty reactions that have been happening with Dr. Amy Acton and, the OC board, Nicole. I mean, it's just crazy right now. So without further ado, please welcome to my studio, Dr. Alya Khan.
Thank you. It's a pleasure to be here.
I'm so glad you could make it. Thank you for making time. And I know that you have a patient in about 45 minutes. So without further ado, I'm going to start just rattling off questions that I promised my listeners that I was going to ask you. All right?
Sure.
So the first big question is, what is the truth or the research or the science on face masks? Do they help or do they hurt in protecting one from COVID-19?
Yeah, so to get to the bottom of that, face masks do help. And we have evidence that they do. And face masks largely block droplets, which carry the virus that causes COVID-19. Now, there are different kinds of face masks. So before I tell you how they work and the evidence behind it, I want to tell you about the different kinds. So there are cloth masks, surgical masks, and respirators, such as N95s, powered air purifying respirators, and so on and so forth. Cloth masks and surgical masks are loose fitting, so they do not have a tight seal around your face like respirators. So they're not meant to protect the person actually wearing them. Instead, they protect people around that person because there are gaps on that side. So I wear my mask to protect you, and you wear your mask to protect me. And the background on how this really works is that COVID-19 is caused by a virus that can be carried by droplets. Droplets can be exhaled from people from their mouths and nose if they sneeze, cough, sing, talk, laugh, or even just breathe. The more vigorous or loud, the more droplets and farther they'll actually go. So face masks, like I said, provide a barrier from those droplets getting to another person. So just like with an ordinary cold, we're expected to cover our sneezes and coughs with our elbow or a tissue because we don't want all those droplets spreading everywhere, especially to other people. Now, if someone has cold or COVID symptoms, they should be at home and not be around other people. But one of the things we have learned about COVID-19 is that a significant portion of infections spread when people do not have symptoms. Many of these people are infected with the virus, but don't have symptoms yet can still spread it to others. And that's why the CDC and many public health officials have urged the general public to wear face masks when around other people, especially if there's a chance we may get within 6 feet of others. You did ask about evidence. So there definitely is evidence. Just looking at laboratory testing, scientists have looked at droplet spread versus not wearing a mask versus wearing a mask, and masks do largely block those droplets. There are studies that support mask use. If you look at states like New York and Utah, when they had a mandatory mask order to go in effect, we saw a decline in new COVID-19 cases after their mandatory mask order went into effect. We also saw a similar trend in a city in Germany where cases went down significantly after a majority of the people started wearing masks. There was a case of actually an outbreak at the USS Theodore Roosevelt aircraft carrier, and we saw a decrease in the COVID-19 risk for those that wore masks compared to those that did not. Now, I want to tell you what's really remarkable is that there were 2 hairstylists that had COVID-19 with symptoms, and they came into significant contact with 140 clients and several coworkers. These 2 hairstylists wore masks, as did the clients. Guess what? None of the contacts developed COVID-19 or symptoms of COVID-19. There was a case of a man with COVID-19 who went on a plane while wearing a mask, and none of the nearby passengers in relation to this person developed COVID-19.
So
go
ahead.
No, so
you're on a roll. I like it.
So I was just going to say that as a physician, and you asked about do they help or they hurt, which is an important question because as a physician, I assess recommendations based on risks versus benefits. So what is the benefit of wearing a mask versus the risk of wearing a mask? I already told you most of the benefits. The other benefits include not having to wear your makeup, not over smelling any bad breath, right? But what is the risk? Really, the risk would be if you do not use your mask properly. So if you're constantly fixing your mask and thereby touching your face, that wouldn't be good. So I would recommend using a mask that fits your face properly, covers your nose and your mouth, and is comfortable. Because if it's not, it won't be as effective. So for people who are masking, I say try some out, do some adjustments. You may have to try out different fabrics. It's also really important to clean your hands before and after you touch your mask, and to clean your cloth masks daily. In the end, masks are not the be-all, end-all. At this point, we are trying to reduce risk in combination with other practices like physical distancing and hand hygiene. And if we want to continue reopening our economy, as which is obviously a big priority for all of us, and avoid going back into shelter in place, taking these kinds of measures will help us ensure that.
Now, all of that makes perfect sense to me. It is common sense, which if I scroll through my feed, it is absolutely uncommon, because I will hear people say this is conspiracy, trying to keep us in fear, that it's a big marketing ploy to put us in fear, or to ruin our economy, ruin our livelihood, or that, this person says masks, this doctor says that masks are going to hurt you. And there was one saying that you could actually get some kind of poison by using the mask. And then I have people who say, I can't breathe in a mask. And so, don't tell me what to do. And you can't tell me what to do. And you can't give me a restriction, and don't arrest me. And I have asthma and I can't breathe, blah, 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 blah. So can you tell I'm, bombarded with this stuff? I've never been unfriended or unfriended so much in my life over this one thing, because it seems like common sense, not rocket science, and yet it's created this giant divide between people. Like, why is that?
That's a great question. It shouldn't be a controversial subject. It's science. It's a public health topic. We are in a public health crisis, and there's a consensus among scientists and public health officials. It's hard for most people to change habits, right? So wearing a mask is not part of our culture, where it is in other areas of the world. Besides the 1918 flu pandemic, which many of us were not around for, we have never been told to wear a mask due to a virus. But this virus is new, and I understand why this is a confusing topic. With that being said, surgeons, dentists, construction workers, many industrial workers wear masks for prolonged periods of time, sometimes under strenuous physical conditions. Some industrial workers wear tight-fitting respirators with cartridges, like painters. You may have seen that. They're much more difficult to wear than a surgical or cloth mask. So surgical and cloth masks, like I said earlier, are not tight-fitting. They allow plenty of exchange of oxygen.
Yeah. So that is one of the things I want to go back to. For those of you who are wondering who I'm talking to this week, welcome to my show. Take my advice. I'm not using it. Get balanced, especially today with Dr. Marissa. My special guest is Dr. Alya Khan, who is not only a medical doctor, but also an environmental toxicologist. And I really wanted her to come on to, talk about the BS, the belief systems that are helping and hurting us in our safety with respect to masks. So I want to go back to one thing that you said earlier, which is I wear my mask to protect you, and you wear your mask to protect me. Because that was one of those, if it doesn't really matter what you do as long as I have a mask on, but that's not true. And if that is true, it's such a dilemma, because if we don't all do it, it's as if you have a private pee section in a public pool, right? Because if I do it and you don't do it, it's hurting us all.
It's a community effort, it's a collective effort that we need to do. And that's why getting this message out to as many people as possible is so important. The more of us that wear masks, the less likely the rate of new COVID-19 infections will decline. Mm-hmm. So this is really something that as individuals can do. It's a small part, a small sacrifice really to help with a greater good, but also protecting those around us, right? Those our loved ones, people who are elderly, those with underlying medical conditions that could put them at a higher risk of COVID-19. Mm-hmm. We want to take care of those people around us.
Absolutely. I know it's been really tough. I have an 87-year-old and 90-year-old adopted mom and dad, and I have not been around them for over 3 months, and it hurts because I love them and I see them a couple times a week normally. Mm-hmm. But because I do care about their health and the risk, you know, and I went through a COVID scare. I woke up with COVID symptoms, waited 10 days to find out about the tests. And I think that also helped me because I see all these posts. Do you even know anyone who's had COVID? Or, you know, and it's like, do you have to have someone close to you die of it in order for you to go, wait a minute, the numbers and the not wearing of masks, the wearing of masks and the decrease of numbers. What is it going to take for people to actually put aside their, you know, it's all about my selfish interests, or it's all about, and that sounds like judging, I admit it. And there's a lot of people, you know, who are friends, who just made it through the unfriending phase, who say, but this is my choice. But how do we communicate, Dr. Khan, to people who just refuse to wear a mask and say that we're mask shaming them, or as my 90-year-old dad says, reverse mask shaming? How can we get there? What do we need to do? And maybe that's not a question, you know, that can be answered.
Yeah, I mean, I struggle with that too. It's a valid question, and someone has a strong belief in a certain way. There's sometimes very little you can do to change people's minds, but my approach has been with talking to anyone about change is sticking to the facts, right? Like I told you about, you know, if people have misconceptions about masking, maybe they don't understand about COVID-19, you know, relaying those facts, and certainly, you know, not shaming anyone for decisions that they need to, that they're making, and, you know, there may be a reason that they're not wearing it. I don't know. But in the end, like I said, getting that public health message out that masks are safe. And really at a time like this, we really need as many people to wear one. Mm-hmm. I know they're uncomfortable. I know it's not easy.
Of course.
It's not meant to be. It's something very different. I mean, my kids don't like it, right?
Right.
My husband the other day was complaining, you know, his nose was itching while wearing a mask. But we do it anyways, right? We're just trying to protect those around us.
Right. And when we were doing our pre-interview, you know, you and I have close friends and family who may not see the importance of this. So how do you communicate? How do you make okay with that? You know, I guess that's not even a question you can answer. It's like a daily thing. I teach a moving meditation in the morning, and there's one form called polishing table, and it's just trying to just polish the irritation off. It's so frustrating though. So, but let's move to something that we can actually do something about. So you mentioned 6 feet away. So I guess for me, when I go out and I am, let's say, going to an event, okay, not a big event, but we've been talking about getting together for a choir rehearsal. I'm with the Agape International Choir. And if we wear masks and are 6 feet apart, I should not be afraid, correct? Like, I mean, can you do closer than 6 feet when you have a mask? or is it 6 feet and a mask?
So when I think about these things, I think of it as a continuum of risk. So what do we know? We know that for example, being indoors is more dangerous than being outdoors in this pandemic because of the air circulation, right? Okay. So if you're gonna be gathering in larger groups, outdoors is preferred. And as I mentioned earlier, singing can release droplets. So these loud choirs singing can definitely do that. There was even a case where that happened in a church where many people got COVID-19. The more physical distancing you have, you're reducing the risk, and the masks are adding to the droplets. So we want to do all of that, right? We want to try to lower the risk as much as possible. You're never going to get to 100% risk reduction, right? You're never going to get that 0% risk, but you want to try to do as much as possible. So the more distance you have, having type of barriers, also duration of time around people. So the longer you're around someone, the higher the chance of getting COVID-19. So it's really, assessing the situations that you're going into, and it's not always a black and white issue.
Yeah. So what about face masks and face shields? So if you're wearing a mask, is that better than a shield? Should you have both? Talk to me about that.
Yeah, that's a great question. One of the advantages of a face shield is that it protects the eyes and it prevents the wearer from touching the face or the mask. So there are situations in the healthcare setting where this is used in addition to mask use. In the community, there's currently no recommendation to wear a face shield for regular everyday activities. The problem with most face shields is that there's a significant opening in the bottom, top, and sides, so droplets could still get out and you can still get exposed from those openings. But if someone does choose to use a face shield when there's sustained contact with other people is expected, we want to wrap the sides around the face and extend it to below the chin. So I've seen some pictures where that's been done. It kind of looks like a beehive head covering, if you can imagine. And this kind of situation or this kind of face shield may be useful in a setting like a school where teachers still want their students to see their face. But right now, though, for the community, we're focused on source control, and masks are one of the best ways to do that.
Okay. So if we go by your risk assessment scale, so mask would be, if you have to choose between the two, mask is better. If you add a mask and a shield, it's better, right?
Yeah, technically.
But maybe not significantly better. So if you had to choose between two, it would be the mask. And then if you wanted additional protection, it would be the shield. And even more additional is to cover the shield. To cover the sides. Yes?
Yeah, so we don't really know how effective face shields in itself are or benefit they are in source control or protect others from respiratory particles. So that's why there's no recommendation to use a face shield alone. But like I said, in the healthcare setting, it may be appropriate in certain situations to use a face shield to protect the eyes as well as wear the mask in addition. But if someone is concerned about wearing a mask, whether they have extreme claustrophobia or something like that, wearing a face shield is better than not wearing anything at all, actually.
Got it. So let's move to the numbers. So it didn't help that CDC said that they inflated the numbers, which everybody uses as now going to the extreme. All the numbers are made up. If you don't test it, you're not going to have the numbers. It's just crazy. Everybody's using the same information to warp it around whatever their BS, their belief system is. So where do you go and what do you know? Like, where do you go for your reliable information? Where do we go to really, know what's the truth? Like that it's not inflated, that it's not made up, that it's, what is the truth?
So first I'm going to say, I think knowing which resource not to trust is just as or even more important. So if you're getting your resources from YouTube, Facebook, WhatsApp groups, that's not a good idea. One of the issues with COVID-19 is that this is literally a new virus. Scientists have only known about this virus for about 6 months now. Because it's new, we had to learn everything about it from the ground up, and that takes time to do. So as we learn new information, our recommendations may change, and they may continue to change. Scientists around the world are working nonstop on understanding the virus and how to manage it. So to your question directly, it depends on also what kind of information you're looking for. So if I'm looking for data, how many COVID cases there are in my area, how many deaths, et cetera, Johns Hopkins has a great map of the world, and it can literally go down to your county. Your local health department websites also have information on local data. I'm in Orange County, so I'm looking at the data coming out of the Orange County Healthcare Agency. And if you're looking for general information on the disease, such as symptoms, preventive measures, I looked at CDC's website, as well as academic institutions like our local UCs, Stanford, Johns Hopkins. I also reference peer-reviewed journals, such as the New England Journal of Medicine. And it's certainly, if someone has a question about themselves or a loved one, I would recommend they speak to their personal physician.
So let's move to that. So when should people get tested, or when should they have some alarm, or when, should you get tested when you don't have symptoms? And then this is a question for the lag in the testing and in the results. How is that, or is that impacting the numbers and how serious this is? And let me back up 1 second, because this is the most important question. It's for people who are listening who say, this is just a flu. This is just a flu. And a lot of people die of the flu all the time, and it's no big forking deal, that it's just a flu. So quit making this into this giant marketing campaign to scare us to death, literally. So please speak to that.
So I'll take your last question first, if that makes sense. Yeah. So the seasonal influenza, the flu, and the virus that causes COVID-19 are very different. Yes, they can cause similar symptoms in the milder stage, but COVID-19 has unique findings, especially in the more severe cases that lead to death. One of the things we knew early on was that the virus that causes COVID-19 is more infectious than the flu virus. That means on average, someone can spread COVID-19 to more people than it can with the flu virus. So it's important because it affects the rate at which this pandemic progresses. So I'll give you an example. If one person infects 2 people and those 2 people infect another 2 people and so on, you have a problem. The CDC gives estimates on annual deaths for the flu. But if you compare the weekly death rates of COVID-19 from 3rd week of April and compare that to a typical influenza season, the rates of COVID-19 death on average were 20 times higher than the actual flu deaths. So you can just imagine how frontline healthcare workers became overwhelmed. COVID-19 also caused an increased rate of hospitalizations and demand for ventilators and increased staffing. And that also overwhelms the healthcare system much more than a typical flu season. As we have many healthcare workers getting sick and even dying from COVID-19, sadly. So no, the COVID-19 and the regular flu are different, very different. For flu, we have a vaccine as well. So that also reduces transmission and severity of flu. And I always encourage everybody, all my patients and family members, to get their annual flu vaccine, which you should still be doing. So coming this fall, please get your flu vaccine, because we're going to see a rise of just regular plain old flu that's going to be compounding our healthcare system. Go ahead. No, you asked about, when should you get tested, right? And so if you have symptoms that could be COVID-19 related, such as fever, cough, trouble breathing, diarrhea, nausea, vomiting, kind of like a broad overview of symptoms, call your physician to get an evaluation and also self-isolate. So stay at home.
Yeah, that's exactly what I did.
Yes, that's great. And testing is pretty available now. So your physician will be able to assess if a COVID test is appropriate. In some cases, it may even be appropriate to do testing if you don't have symptoms. For example, if someone has been exposed to someone with COVID-19, so that means within 6 feet for at least 15 minutes, it may be appropriate to have a test a few days after the exposure. But right now, they're most useful for people with symptoms.
Okay. So, but that's a key thing right there. So 6 feet, less than 6 feet for more than 15 minutes.
Or at least 15 minutes.
At least 15 minutes might be a good idea to get tested. And if anytime you think you may have it, isolate, right? Do not, don't err on the side of, oh, I probably don't have it. So going back to the ventilator, I have a friend whose very close friend was, middling aged, not older, not younger, perfect health, no history of anything, got COVID, was hospitalized, put on a ventilator. I think she was treated for almost a week. She got better and then was discharged. 2 days later, she died. So when I was sick and my daughter was like, you got to go to the hospital, you got to, and I'm like, no, no ventilator for me, because that's what happened to her. And what I heard, not from necessarily a scientific reputable source, but I heard, actually it was from a nurse, that ventilators weren't working because the bacteria or the virus loves pure oxygen. And so the ventilator is actually hurting the patient and helping the virus. Please tell me the truth.
So not everyone needs a ventilator. Like you were hospitalized. Most people who get COVID-19 will have what we would say mild symptoms. Technically, you probably know this best because I haven't had COVID-19, thankfully. But those symptoms are not really mild. You're pretty down for it, right? I was down. You're tired. You're exhausted. And many people have prolonged symptoms where they are not able to get their exercise capacity back even after they recover. So it's a significant disease, even if you don't end up in the hospital. And if you do end up going to the hospital, not everyone needs a ventilator. A ventilator is there to provide that extra support for oxygenation. COVID-19 in some cases can cause an acute respiratory distress where your lungs cannot function without that extra support. So physicians in the ICU make those decisions on a case-by-case basis. It also depends on the risk of the person, what are their underlying medical conditions, their age, and their capacity to keep on breathing and not tiring out. And what we are learning about COVID-19, it leads to all kinds of complications. We've seen even young people develop strokes and blood clotting issues from COVID-19. So as related to your friend, I'm really sorry to hear about that, and my condolences to her and her family.
Yes.
And, without knowing more about the case and what exactly happened, I really can't comment on that specifically. But certainly, if you are sick, call your doctor. And your doctor will make the assessment of what you need to do, whether you need to stay at home or come into the hospital. Do not be afraid to go into the hospital if you truly need it. And even if it's not COVID related, if you are having chest pain that could be indicative of a heart attack, do not wait, go in. Hospitals are well equipped and taking all kinds of precautions to protect all their patients.
Right. And I did call my doctor whose response was, we're not seeing COVID patients. So there's an added, but I don't want to go there. That's just a personal thing. Where I do want to go before we run out of time is 1, antibody testing. What is that? And 2, false positives, false negatives, and numbers.
Yeah, we could probably spend another hour on testing.
I know.
I think what's most important is to understand that there are 2 main tests that have been utilized to make the diagnosis of whether someone actually has COVID-19. is what's called a PCR testing. They basically do a swab all the way back into your nasopharynx area. It's very uncomfortable. You have that test, right?
No, I had the other one.
Oh, you have the other one. Okay.
Mm-hmm.
So this test goes all the way back into your nose, and it literally makes you cry. So I had this test done myself. I believe it. If you don't cry when they're doing the test, they probably didn't do it correctly. And that's looking at whether you actually have the virus. The antibody testing, though, is just to provide an overview. When we're exposed to a pathogen like a virus, we mount antibodies, which can be protective if we get exposed again. So we still need more research in this area. Currently, we do not know if antibodies would be protective against developing COVID-19 again, and if so, for how long? So, and there's also the issue of some of these antibody tests have false positives, meaning it says you have antibodies, but it could be antibodies to another type of coronavirus, like the other 4 that cause ordinary colds. So, and then with the other types of, with the other diagnostic, I should say, tests for COVID-19, the more your doctor will be able to assess whether the COVID-19 test is appropriate, because your symptoms may or may not be related to COVID-19. So your doctor will then determine if the test is appropriate. And generally, if it is appropriate, it's more likely to be positive around day 5 of your symptoms. I mean, there's also a possibility of what we call false negatives when you actually have COVID, but the test is negative. So.
Right. So that's my concern, because mine was negative and we all celebrated, but I had the, do it yourself swab in your mouth. So then I'm like, well, was that like, it didn't make me cry. So maybe that wasn't the true test. And maybe should I get tested again? I don't know. So again, all of these, what is, okay, let's go this way. So for me, it's all about me. It's my show. I was tested negative. I was sick for probably 7 or 8 days, all the symptoms, and waited to get the test results, didn't get them, and got better. And then I got the test results saying I don't have it. So now I wear a mask. I do the sanitizer. I wash my hands. I still use my elbow on the elevator. I don't hug people that I am not pretty sure that they're using face masks and safe. What do I look for? Like, do I get tested again and get, make myself cry with the nasal one, or what should I do?
In terms of doing another test, I wouldn't recommend that at this point. Okay. If you don't currently have any symptoms and you're past 10 days after your symptoms, the test will likely be negative at this point.
Okay, good.
And the antibody testing, like I mentioned, we're just not there yet to make those individual assessments whether the antibodies you do mount on there would be protective or not. So we're urging people, regardless if they've had COVID-19 before, symptoms of COVID-19, positive antibodies, to still take those precautions, wear the mask, do the physical distancing, hand hygiene, all of those things that we already talked about.
Now let's put another moose on the table, because there's a lot of people who are very anti-vaccine on top of being anti-mask, or they're for masks but anti-vaccine. Tell me about vaccinations.
Well, we don't have a vaccine for COVID-19 yet. Hopefully we will. And like I mentioned earlier, we have a flu vaccine. And I encourage everyone to get that on an annual basis. You do not get the flu from the flu vaccine, which is a common myth. Okay. And even if, what's interesting is that even if you do get the flu from the flu after you got the flu vaccine, because it's not 100% effective, it will reduce your symptoms. So may reduce the duration of your symptoms or make it less mild for you. So that's why I really encourage everyone to get the flu vaccine. I get my kids vaccinated and my husband, and encourage all my family members to do the same, because it also is protective of other people. It's another way. Not everyone can get vaccinated against the flu or some other vaccines, such as people who have immunocompromised conditions and babies and those kinds of people.
So more myths before you have to go. COVID myths and face mask myths.
Wow, that'd be another hour.
I know. I've already got messages from people. You have to have her back.
That's wonderful. So, I already kind of alluded to the issue of mask myths, right? That we can't wear this mask. It's too hard to breathe, and I'm not getting enough oxygen in, and those kinds of things. And that's not really true. When I mentioned that surgical and cloth masks are not tight fitting, because they're going to still have some gaps around. So that's going to allow exchange of oxygen. If you really want to get down to the evidence of it, there was a study that looked at how healthcare workers function with surgical and N95 tight fitting masks. So the N95s are not what people are being told to wear. Those are the tight fitting ones that healthcare workers are using. And what they did is they tested these people while they were exerting themselves moderately. And they wanted to see how their heart rate responds, their blood oxygen level, even their comfort level. And what they found is that there was no significant difference compared with someone who wasn't wearing a mask to those who were wearing these masks. So basically, any type of covering your face, like I said, can be uncomfortable. It's not easy. Many of my colleagues have been wearing tight-fitting N95 masks with face shields, gowns for 12 hours and working and taking care of these patients. And that is hard for sure. But the cloth mask and the surgical mask, like I said, you can pick different types of fabrics. The surgical masks tend to be a little bit lighter and more comfortable to wear. But there is no evidence that these type of masks will interfere with the body's function to breathe, like I mentioned before.
Right, which is a huge forking myth going around social media right now. Ask me how I think about that. Cloth masks that are homemade, like bandana, the gunman's, and just the homemade ones versus the ones you buy from CVS or Rite Aid. I can't be accused of favoring. So, which one is better, a cloth or the ones that you actually buy?
We don't know yet. To be simple, we just don't have the research. It's going to depend on the fabric, right? So, like I mentioned earlier, the tighter weaves tend to be more effective as filters than the looser weaves, just because we know the face masks are not tight fitting, so the edges are the issue. Okay. But really, what I want to emphasize to your listeners is that any type of covering on your face, it can largely block those droplets. So that's what I encourage people. If a bandana is all you got, go ahead and put the bandana on. If you have access to a mask from a store, wear that. Whatever you have on hand. But also, we're in Southern California. I encourage the fashionistas to be creative with their masks. I mean, I know some luxury designer brands have created masks as well. So have fun with it, right?
And so when you have the mask on, I've seen people have the mask on, and then when they go to talk, they pull the mask down and talk. That's kind of defeating the purpose, correct?
Yes.
Okay.
Yes.
I just wanted to go on record.
Keep the mask on. I've seen some people take the mask off to sneeze.
Oh my gosh.
So no, please keep the mask on when you're talking, when you're sneezing, especially. It is defeating the purpose. I know it's hard to hear people when you have the mask on. Right. I completely understand that. Sometimes I'm taking phone calls with my mask on, and it's a bit of a challenge. So I completely empathize with that.
Right. So even outside, when you're outside and you're more than 6 feet away, it's still safer to have a mask over your mouth, correct?
Yeah, so like I talked to you about, it's all about continuum of risk, right? But you definitely, there is an expectation that you may get within 6 feet of people, you definitely want to have a mask on. And that's what the current mask order entails, that if you are going to be outside and you're expected to get within 6 feet of people, you want to wear a mask. Now, if you're taking a hike in a relatively dense or not populated area, as many of our areas in Southern California maybe, then I don't think you don't have to wear a mask. I've taken hikes with my children and we don't put one on. But certainly if we know we're going to be going to a crowded area, then I'll preemptively have my mask on.
Got it. So what do you have hope that we're going to get this under control? What is the best case scenario of what you think is going to help us get out of this?
I think we all need to rally together. Like I mentioned before, physicians and scientists all across the nation are performing critically needed research, working in the ICU, analyzing peer-reviewed research, and we're holding our patients' hands. So fighting a disease like this that we know little about can seem scary, but the American thing to do is to stand up united and fight. So my bottom line to your listeners would be wear a mask, stay 6 feet apart, wash our hands, regularly disinfect commonly touchable items like door handles. Let's all do our part. And I'm going to tell you, I read a great article in the LA Times recently in which the scientist Lucy Jones said of this pandemic, don't share the air. So I think if your listeners take anything away from this is that don't share the air.
All right. And my last question, I know you have to go, but I ask all my guests this, who or what are you most grateful for?
It's a great question. So, this pandemic has caused many of us to be at home for more than we're used to and not have the simple convenience of going to a restaurant or getting on a plane to visit family and loved ones. And so it's been a challenge for everybody, but it has forced me personally to enjoy the simple things in life and to enjoy those quiet moments or sometimes loud moments with my family, and just be at home and just kind of enjoy each other, enjoy nature. So really, if I have to pick one thing, I would be most grateful for that.
Oh, that's beautiful. I do need to let you go. I don't want to be, because I know what it's like to sit in a waiting room when your doctor is late. So I don't want to do that to you. Thank you so much, Dr. Khan, for coming on and sharing your science and your data and your thoughts and your caring. Thank you so much.
Well, thank you so much for having me.
Absolutely. All right. I purposely did not thank the sponsor in the middle of the show because I knew she had to leave. So we're going to go, Tony, and thank the sponsor of today's show. I'm going to let you guess who that is. And just a little appeal. If you have a product or a service out there, you enjoy this show, you are of like mind and love heart, and you'd like to be endorsed and promoted on this show, please do. Contact me, very affordable rates because of COVID. Just go to drmarissa.life and let me know. I mean, we're down to like 188 from $1,800 commercials. So just contact me for future shows. All right, here we go. Want a little TLC? How's your self-care? Want a mental health tune-up? Before you go to the fridge again, check in with Dr. Marissa, your happiness cheerleader, who wants you to put on a life jacket with a hashtag COVID silver lining called self-love in this weird time of life. Yes, it's a tough time to be happy, but it is possible with some new BS belief systems and happy 88 tools that will decrease your stress and increase your immune system. Go to www.drmarissa.life and schedule a Zoom session and learn the art of self-care, self-love, and more. You may not be able to change the wind, but you can change the direction of your happy sails. Visit drmarissa.life today. Oh, I I just realized I forgot to give her Dr. Marissa's Beneficial Presence on the Planet Award. I'm going to have to tell her later. Hopefully when she listens to this later, she will get that. So let's give her a nice round of Beneficial Presence on the Planet. Wasn't that forking awesome? I mean, she hit every single question that I had. And I hope you're not on the fence anymore. I hope, I can't imagine people who really were anti-masks that were listening in, but you never know. And I really, 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 really hope that this episode gets to as many people as possible. And you can help me with that, because we all really need, as she said, this is about United States. I mean, it's kind of embarrassing that we're always in the news for higher numbers. It's embarrassing that California continues to lead. And it's embarrassing that where I, raise my kids in Orange County is always in the news for some kind of bad behavior. So please, 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 it's time. Humankind, emphasis on the kind, United States of America. So there's my personal appeal. And with that, let's go to Balance Bar, which is the end of the show. Thank you for tuning in today. This was a very important one. And at the end of every show, I say where I am balancing, and I see that I'm out of time, but please go to Medium. I'm grateful. I have over 1,400 reads now. I didn't have time before to write since the book, but now there are. Go to my YouTube. It's now over 204,000 views of all the same splattering of hope and happiness. So please do share me. Zoom sessions. I'm doing those private and group. I'm doing one today. If you want a little tune-up, positive psychology with laser coaching. Don't need 10 years. And if you want to be part of my TV pilot called Turn Yourself On with Dr. Marissa, July 11th is the date. Only 48 in the Zoom audience. And we're going to laser in on how you can be happy 88% of the time. Go to my drmarissa.life, put TV pilot in the subject line, and you'll get information on that. And I think that's it. I hope you have the best day ever. I hope you wear a mask. Please. Peace in, peace out. World peace through inner peace. Dr. Marissa reporting live all the way here from the ocean of abundance just for you. Love y'all.